Good morning, and thank you for joining us on our cable, YouTube, and Facebook channels. We are here today to announce that an agreement has been reached for a second significant medical tourism project for the Cayman Islands to be known as Astor Cayman Med City. This briefing will aim to share with you some of the details of the agreement. After a brief presentation by the panel, we will open the floor to questions from the media. Present and participating on the panel this morning will be Premier the Honourable Alda McLaughlin, Minister of Health, Honourable Dwayne Seymour, Project Director for Astor Cayman Med City, Mr. Gene Thompson, Chairman and Managing Director for Astor DM Med Healthcare, Dr. Azad Mopin. He will be joining us from Dubai. Deputy Managing Director of Astor DM Healthcare, Ms. Alicia Mopin, also joining us from Dubai. At this time, we will now hand it over to Premier Honourable Alda McLaughlin.
Thank you. Hello, everyone. Thank you for joining us today as we make this exciting announcement regarding a partnership between the Cayman Islands government and Astor DM Healthcare to develop a new, modern, world-class medical facility in these islands to be known as Astor Cayman Med City. Immediately following this press conference, we will execute the legal agreement. Dr. Mupen, I suspect, will speak to you about Astor. But to provide some background as to why this announcement today is important, I wish to point out that Astor is a large, well-respected healthcare group headquartered in Dubai and has been in existence for over 30 years. I understand that it has over 19,000 employees working in some 350 various medical facilities across 8 countries. Astor is also a publicly traded company on India's National Stock Exchange, the leading stock exchange in that country. Dr. Mupen, I am advised that when the news of Astor's entry into Cayman was announced to the financial press a few days ago, that the financial market responded very favorably indeed to that news. That, in my opinion, not only speaks highly of the decision of Astor's management in expanding to this region, but it says much about how well the Cayman Islands is viewed internationally as a place for world-class tourism and commerce, as well as an emerging healthcare tourism center. My point in noting the size of Astor is to indicate that the group is a significant medical services entity across the countries that it operates in, providing every aspect of healthcare. Astor Cayman Med City, when complete, will provide healthcare services primarily to medical tourists, but also to the residents of the Cayman Islands. The project will be carried out in phases and will comprise a hospital, assisted living and independent living quarters, and a medical university. The total cost of the project is estimated at some US $350 million. Phase 1 will comprise a 150-bed multi-specialty hospital on Grand Cayman, offering primary, secondary, tertiary, and quaternary care, very specialized medical care that is currently not available here. Phase 1 is expected to be completed over some 3 years. During this phase, Astor will also establish a clinic on Cayman Brac. Phase 2 will provide an assisted living and independent living facilities, each comprising 100 units. The plans anticipate Phase 2 to start about 3 years after the hospital has been operational. Phase 3 will comprise a medical university, which will be integrated with the hospital. It is expected that the hospital will also be expanded to about 500 beds during this phase, and the assisted living and independent living center will also be expanded. Phase 3 is expected to start about 7 years after the hospital has been operational. As part of this agreement, Astor will use local contractors and local service providers during construction. Additionally, the company will be employing suitably qualified Caymanians over the various phases of construction and when the facilities are operational. Of course, those who come from elsewhere to work with the hospital will need homes to rent or buy and will shop in the local economy. I'm pleased that a local partner in the project is Mr. Gene Thompson, Not only is Gene a successful Caymanian businessman, but he was instrumental in the build-out of Health City, Cayman Islands, and worked to successfully establish that facility, and thus brings a wealth of knowledge in the healthcare tourism sector. And as we all know, during the development of Health City, Gene also worked to ensure that Caymanian businesses and Caymanian workers benefited from the construction of that project. I know he will do the same with this project. As part of the agreement, ASTR will develop and implement, in collaboration with the Ministry of Education, an educational program for local students who are interested in healthcare. They will also fund an annual scholarship which will be administered by the Department of Education for US $50,000 yearly for a period of 2 years, and US $75,000 yearly for the next 2 years, and US $100,000 for the 5th year. And as I have mentioned, ASTR will also establish and maintain a clinic in Cayman Brac with supporting services including telemedicine and an infusion center. The government has agreed to the following to help facilitate the earliest completion and the future success of the project. No duty on life-saving equipment and medical supplies for a period of 25 years after the commencement of construction of Phase 1. No duty on other medical equipment and supplies for a period of 25 years after the commencement of construction of Phase 1. For clarity, government will not defer, waive, or reduce custom duty for materials, equipment, supplies, or items of any kind to be used in or for the construction of ASTR Cayman MedCity or any of its facilities, nor will it waive or reduce stamp duties on the purchase of any land being purchased for the development of the facility. The duty concessions extend only to medical equipment and medical supplies intended for the use and consumption of ASTR Cayman MedCity and its patients. ASTR cannot resell any medical equipment or supplies to anyone but its patients. The government has also undertaken to use its best endeavors to assist ASTR with efficiently moving through its various applications and license requests needed to complete the project. However, the company will need to meet the requirements of all applicable laws and regulations related to construction and development, work permit applications, or for healthcare facility licenses, etc. The government has also agreed that over a 5-year period from the date the hospital commences operations, that no other non-Caymanian, non-existing, or currently non-existing medical tourism provider will be permitted to come to the Cayman Islands to compete in the field of large-scale medical tourism. However, such exclusivity from competition does not extend to any provider of medical tourism services that is already designated as medical tourism, to any non-Caymanian company that currently offers medical services in the Cayman Islands, or to any Caymanian who intends to establish healthcare facilities of any kind in the Cayman Islands. Given the size of the project, a 5-year non-compete clause is not unusual, but what is important is that it is only for 5 years and does not apply to Caymanians or existing medical businesses here. Before closing, I want to add that I am delighted that an organization of ASTR's caliber is investing in such a substantial way and in such a meaningful project in our islands, especially at this time of such uncertainty globally. ASTR's willingness to invest several $100 million in the Cayman Islands economy to develop this world-class facility, in spite of the global economic impact caused by COVID-19, speaks volumes of their confidence in the Cayman Islands, and it also speaks volumes of its confidence in the resiliency of our economy and our people. To sum up, this project will not only help to further diversify and strengthen our economy, in particular a healthcare tourism product, but it will also provide employment and new opportunities for our people during the construction phase and when the facilities are completed. ASTR Cayman MedCity, together with Health City and the smaller medical tourism facilities on island, will further put the Cayman Islands on track to become the preeminent regional center for healthcare tourism. ASTR will also provide needed tertiary and quaternary care services to our own domestic healthcare market, including a clinic in Cayman Brac. Add to the mix a healthcare education program, a U.S. $350,000 5-year scholarship program, a future medical school, and assisted living and independent living facilities. Again, this is a very positive and beneficial project for the country. I thank Dr. Mupen and the Astor Group for their confidence in the Cayman Islands and the Caymanian people. I also thank Jean Thompson for working to help bring Astor DM Healthcare to the Cayman Islands. And I thank the Minister for Health, the Honorable Dwayne Seymour, and his staff, as well as the government's legal team who have worked for several months to get us to this stage. Finally, I thank my cabinet colleagues for supporting this important initiative.
Thank you, Premier McLaughlin. We now welcome remarks by Minister of Health, the Honorable Dwayne Seymour.
Thank you. Good morning, everyone. As Minister of Health, Environment, Culture, and Housing, I could not be more delighted to see this venture come to the Cayman Islands. Dr. Mupen, Alicia, Astor's team, thank you so much for choosing the Cayman Islands as over many competing countries in the region. For instance, although costly and disruptive to people's lives, we thought we could rely on Florida or Texas for tertiary and quaternary service. We never expected that we would be able to travel there easily or indeed feel fully safe when traveling. Thanks to the efforts of our government, we have been very successful in eradicating COVID-19 from our shores and then keeping it out of our communities. But what if it had become established, like each nation has learned, the availability of hospital beds, particularly intensive care beds, is crucial to saving the lives of anyone who become critically ill because of COVID-19. Astor Cayman Med City is a huge step forward in resilience for the Cayman Islands in times of trouble. It ensures our people we have access to some of the most complex of medical services without leaving home, and that we will have more intensive care beds per head of population than even the most advanced healthcare systems in the world. Alongside the institutions we already have here, it makes the Cayman Islands health system world-class. However, this is about so much more than just resilience. It is about becoming a healthcare destination of regional repute, not only in the Caribbean, but indeed throughout the Americas. One that attracts healthcare travelers or tourists from across the Caribbean, United States, Canada, Central and South America, based on the quality of healthcare delivered here, alongside both its accessibility and affordability. It is about becoming the destination for destination healthcare. By having such providers based here, we help attract, invest in our islands, and when our borders are more fully open, travelers on airlines, guests in our hotels, and unprecedented access to the most advanced diagnostics, therapies, and latest medical technology. That's something we can be immensely proud of and reassured by. Each year, our government spends millions of dollars on tertiary and quaternary healthcare offshore. Naturally, we want the best for our people, and so we invest in their health in locations that also happen to be some of the most expensive in the world. But with the same quality of innovations based right here at more affordable rate, that's money we can invest in supporting our people in other ways too. I am pleased for the region too. The challenge we face in providing access to tertiary and quaternary services is not unique to the Cayman Islands. It affects almost every Caribbean nation. The presence of Astor Cayman Med City here, alongside our existing institutions, allows us to provide a greater level of quality healthcare at affordable rates to our fellow Caribbean nations. That's good for them and great for us. I'm also delighted by Astor's enthusiasm and commitment to providing assisted living facilities. We have an aging population, and like so many other countries, we have a changing model of family that makes it difficult for many to care for our most senior members of society. That's not made any easier by increasing life expectancy, bringing with it a host of healthcare challenges that need more professional support. I have long believed we have needed better answers to this issue, and I am so pleased that this project will take various significant steps towards solutions that address both living and healthcare concurrently. This can only improve the later years for our cherished loved ones, providing opportunities for enhancing quality of life that we just don't currently have access to. So it gives me enormous pleasure to welcome Aster DM Healthcare to our islands, and indeed to our family of world-class providers. I am sure everybody will join me in wishing them the best as we all work together in driving forward the Cayman Islands as the destination for destination healthcare. I thank you.
Thank you, Minister Seymour. Joining us from Dubai is Chairman and Managing Director of Aster MD Healthcare, Dr. Azad Mopin. We now welcome him with remarks.
Thank you very much. Good day, esteemed Premier, Honorable Mr. Alden McLaughlin, the Health Minister, Honorable Dwayne Seymour, dignitaries, delegates, citizens of Cayman Island, and members of the press. I'm Dr. Azad Mopin, Founder, Chairman, and Managing Director of Aster DM Healthcare. We are extremely excited about our plans to develop the Aster Medcity as the destination for destination healthcare. Ever since starting our healthcare journey with a clinic in Dubai in 1987, we have been passionate about creating a company based on three core principles of accessibility, affordability, and quality. This helped us to build an organization that now has over 90,000 staff, 3,000 doctors, and 365 establishments across 8 countries in Asia. Today, Aster DM Healthcare is one of the leading integrated healthcare providers in the Middle East and in India, with large network of 26 hospitals, 115 clinics, and 238 pharmacies. We provide the complete circle of care to all economic segments of the population through our 3 brands, Aster, Access, and Medcare. Aster has been able to build a healthcare ecosystem which supports the entire medical needs throughout the lifetime of a patient, from primary to quaternary care, providing the most complex treatments like organ transplants. Aster has emerged to be recognized as a trusted and preferred brand in the markets that we operate. Over the last few years, we have explored to expand our footprint to other geographies to make quality healthcare affordable and accessible to more and more people. We were in search of an ideal location and a supportive government and associates to make this a reality. When we visited Cayman Island and met the Honorable Premier and other senior leaders, we were greatly impressed by the business-friendly environment, the easy accessibility to the highest levels of the government, and the transparency along with quality-focused approach. The excellent people of the island, culture and environment of this beautiful country made us consider the Cayman Island as a potential location for our expansion plans. The more we have known about Cayman Islands and the people here, the more convinced we are about the region as the right choice for us. Getting an excellent partner like Jean was still another important reason for us to decide on choosing this country. We stand by the vision of the Honorable Premier and the leadership of the country to turn the region into the destination for destination healthcare. With our presence in many countries, establishing hundreds of healthcare facilities and looking after 20 million patients a year, Aster has perfected the model to establish successful ventures in new markets. Aster Medcity, our flagship hospital in India, is a great success story for setting benchmarks for quaternary clinical excellence in the region. This hospital brings in a significant number of international patients as part of medical value travel. Aster Cayman Medcity would be developed in the same line, and we hope to attract patients from other Caribbean countries, mainland USA, Canada, etc., to the enchanting island. Aster Cayman MedCity shall strive to provide holistic healthcare, which include wellness, preventive and curative medical care, including tertiary and quaternary level treatment. We hope to make Cayman Island the destination for destination healthcare in the Americas region. Currently, there are 1.4 million Americans who travel out annually for medical care. Our hospital would cater to this population and create a prominent position in the World Health Tourism map for Cayman Island by providing quality healthcare at affordable cost. Aster Cayman MedCity would strive to bring in many specialist services for which Caymanians have to travel abroad and spend millions annually now. While we shall start the work on develop the 150-bed specialty hospital, which would be commissioned in the next 2 to 3 years, we plan to develop an assisted living facility and medical education facility in the long term. Availability of medical professionals is a major challenge that the world faces. To address this, we established a medical college with 150 MBBS admissions, a pharmacy college, and a nursing college 10 years back in India. Our plans to establish a health university in Cayman Island shall follow the same model. We feel confident that this association would be a win-win proposition for both Cayman Islands and Aster in view of the market potential and our capabilities. As I close, I request the support and blessings of each one of you to make this dream a reality. I profusely thank the Premier for the interest that he has shown, as well as the Health Minister for the support that has been given, and everyone in the government who has been so supportive for this to start. And we promise that we will make this dream a reality. Let me wish you all a Merry Christmas and a Happy New Year in advance. Thank you all.
Thank you, Dr. Mopen. Also joining us from Dubai via Zoom is Ms. Alicia Mopen, Deputy Managing Director of Aster DM Healthcare. We welcome her now.
A very warm good afternoon to the esteemed Premier, Honorable Mr. Alden McLaughlin, the Health Minister, Honorable Dwayne Seymour, esteemed delegates, dear members of the press, and everyone in the Cayman Islands. I am Alicia Mopen, the Deputy Managing Director for Aster DM Healthcare, and I'm responsible for overseeing the strategic direction and development of the company, including the expansion of the group into new markets. As we celebrate Christmas and share the festive spirit across continents, I couldn't have wished for a better time for the partnership between Aster DM Healthcare and the Cayman Islands to come to life. We visited the Cayman Islands at the beginning of this year and fell in love with your beautiful islands. And so I want to just add my own excitement and share how keen we are to get started. These are difficult times for many people, and we really hope that a project like this can lift spirits, as well as provide and boost employment to the local economy. We really are not just a healthcare chain. We believe and think of ourselves as an uncompromising center of humanity with persistent clinical excellence. We represent a wealth of human values, which are augmented by skilled and dedicated staff who embody the over and above with a relentless devotion. This is the heart and soul of Aster. We have a local team that we know understands healthcare at a regional level very deeply, while we bring our own extensive experiences of developing cutting-edge healthcare facilities using the latest technologies in ways that can make healthcare accessible, affordable, but with truly world-class quality too. This has been one of our key USPs, which has helped us really emerge as one of the most trusted healthcare organizations in the 7 countries that we operate. We are very much looking forward to working with you to really define the combination of services, technologies that will make the most compelling case to make the Cayman Islands the destination for destination healthcare. But also services that improve the health of the local population and also help solve some of the challenges facing the governments regarding special groups such as our aging population. I also want to stress that at Aster, well-being and a healing environment are very much part of our whole approach. This successfully this has succeeded very beautifully for us at Asta MedCity, which has become a very popular destination for people traveling for health and wellness and leisure from the Middle East, South Asia, and Africa. I truly believe that we can do something very special and unique in assisted living that not only provides the highest quality of integrated healthcare for elderly, but really focuses on creating an environment that focuses on well-being and a fulfilled life. From an economic perspective, over time, the investment by Asta will inject hundreds of millions into the construction sector that has the potential to create nearly 2,000 jobs in both direct and indirect roles. I believe the region also has a strong appetite for right cost, best quality alternatives to the exorbitant costs of US healthcare. Moreover, this really is a massive opportunity for us to tap into the American medical value tourism that sees almost 350,000 people choosing the Caribbean region annually. With Asta's success story of serving advanced quality and affordable care in all the countries that we have a presence, we believe that we have a unique position which would supplement. Once we become a part of something and somewhere, it gets our full commitment, and we are extremely keen to work with everyone over there to bring the best healthcare to the doorsteps of the people of the Cayman, the Caribbean, and the Americas. Thank you all, and wish you all a Merry Christmas and a Happy New Year in advance.
Ms. Mopin, thank you so much for your time. We now hand it over to Project Director, Mr. Gene Thompson.
Thank you, Shanda. Honorable Premier, Honorable Minister Seymour, ladies and gentlemen, I'm very proud to be here today, to be a part of a project that I believe will hugely be beneficial to the people of our islands, our fellow Caymanians, not to mention the other Caribbean countries. I have long advocated, as you know, for the diversification of our economy, and especially into sectors or industries that are growing and relatively recession-proof, and in which the Cayman Islands can play a prominent role. Healthcare in general, and medical tourism specifically, is very much one of those industries, and is relatively unaffected, other than from COVID, by economic swings and recessions, something we have to increasingly be conscious of. It is also perhaps unique that besides bringing investment and revenue and jobs to our islands, it brings people who stay in our hotels, eat at our restaurants, use our taxi services, retail, etc. It brings medical expertise and innovation, which benefits the well-being of our population. And in this case, it brings a great deal of promise for the future of our islands and our population, and of course, job creation, which comes at a time when it is particularly needed. And just to be clear, we will again favor, as Premier said, local construction, local employees, and insist where possible, Caymanians will fill the roles. They will be given the opportunities to do so above others upon being qualified. And that we will continue, that attitude we will continue throughout the entire project. Healthcare tourism is an important and growing industry. Industry reports that citing a consistent 17% compounded annual growth rate, and is predicted to reach to $112 billion by 2024. I can't think of many industries that thrive to that effect, that degree, and I can't think of a single reason why we wouldn't want to be a part of that industry that can have so much benefit. Given what I've already said, and indeed the positive position that we already hold in this area. Across the world right now, almost every major health system is struggling because of the COVID pandemic. The United Kingdom is talking about a recovery to normal taking more than 5 years. Central and South America have been particularly badly hit. As we know, the US is struggling. This provides an enormous opportunity for us due to the backlog for elective procedures and gaps begging to be filled. The challenges faced domestically by the U.S. health system also creates immense challenges to us and to our fellow Caribbean countries of being able to get access to tertiary and quaternary care if they should need them. The Cayman Islands, our islands, are perfectly placed, especially now with such a prestigious group as Astor, to provide tertiary and quaternary care in the region while ensuring that Caymanians always have access to such care. And in the Caribbean alone, just our region, we spend over $8 billion on healthcare annually, with most of that, which is complex care, going to the U.S. at a much higher cost. So we say, why not here? And we will bring it here. I'm also excited about bringing much needed assisted living facilities, or we're excited about bringing those as our family becomes more dispersed, as our population ages. That is something that is very near and dear to my own heart, and which we have a significant and growing need in our islands. In particular, our senior members of society are living longer. Consequently, they're having much more complex health needs, requiring a much more holistic approach and overall well-being, not just in sickness, but in wellness. This is what we aim to bring, creating a community that ensures the right quality of life, irrespective of the stage or support it needs. With Astor, we will be able to provide that. Finally, Honorable Premier, Honorable Minister, ladies and gentlemen, I'm especially excited to be leading a project that has healthcare education and careers at its heart. As many of you may know, I'm a big believer that Caymanians should be looking for careers, not jobs. Education and opportunities it brings are important to Astor, and equally or probably more importantly, important to me. It enables us to provide new possibilities for future generations of Caymanians to ensure that they can actively participate in and benefit from the industry that we're planning to develop and grow as we make Cayman the destination, or the Cayman Islands the destination for destination health care over the next few years, decades. I look forward with my partners from Astor, Dr. Asad Mupan, Ms. Alicia Mupan, and their team to realize our vision and ensure that we create a hospital, assisted living, and education system that we can all be proud of. Finally, this has been a challenging year for everybody, and I'd just like to especially say how appreciative we are for the support of the Honorable Premier, the Honorable Minister, and his government for allowing us to put this project together in this difficult and challenging time. It's not an easy road, and as we look at our other brothers and sisters in the Caribbean of the challenges that we're having, or they're having, and we have this happening here, we're honored. So thank you very much to your government. To wrap up, I'd like to just wish everybody a Merry Christmas and truly happy 2021. 2020 has been a challenge. So thank you all very much for allowing us this opportunity. Thank you all very much for being here. Thank you again to the government of the Cayman Islands for their vision, their leadership, and their support.
Thank you, Mr. Thompson. We will now open the floor to questions from the media, and I believe we start with Cayman News Service. Cayman News Service, Wendy Ledger.
Thank you very much. Can you all hear? Oh, sorry, I think it's on. Yeah, Wendy from Cayman News Service, as you know. First of all, can I just check, because I couldn't hear the Premier clearly, can you give us the concessions for the whole project and not just for the medical equipment, like the concessions for the developments part of it, and then what the concessions once the hospital's open?
There are none.
Yeah, I heard you say something. Medical equipment?
Yes, I did. Those are the only concessions.
So there are no waivers or concessions during the development process? Okay, what about the situation with the work permits for doctors? Is it similar to the one at Health City, or will you be getting separate work permits for all staff?
There are no other concessions. Everything is in accordance with the usual rules that relate to working in the Cayman Islands.
Is there an MOU of some kind between government and a document?
We were signing, executing the agreement following this press conference.
And will that document be made public?
I see no reason why not.
Can I just ask Mr. Jean, obviously some of the things that you've said were said also about Health City, Cayman Islands. So I wonder if you could sort of give us an idea as to why this project would be any different from that, given that Health City has struggled really to bring in medical tourism, and it has actually in the end made itself more viable because it's been able to cater to the local market, and those cases that might have gone overseas have now gone to Health City. So given they had such a terrible time attracting American business, what makes you think this will happen here? And also the same thing goes with the assisted living and the medical section. Health City promised all of those as well, and we've not seen them. So tell us what's different about this project.
So Wendy, I can't speak to specifics about Health City.
But you were involved in that project.
I was
so.
involved in that project, but what I can say is that Dr. Shetty made a very specific and clear statement last year in, I think, June or July, that about 70% of their patients are now international patients. And that was the target that was set from day one. Obviously, I'm not going to speak on the Health City part of it further, just to say that what their growth plans are and what their decisions on expansion are not related to what we're doing. We see a vast opportunity. As I said, the Caribbean alone is an $8 billion plus industry in healthcare. A lot of that goes to the United States at a very high cost. You have Central and South America, and our dear folks at Astor wouldn't be considering this and contemplating this if we and they didn't see the opportunity as well. Medical travel is supposed to be $112 billion by 2025, which was stated earlier. And we believe that's going to continue to grow. In fact, it's going to be compounded by the recent happenings of COVID.
Overall, then, what would you say the benefits are to the people of the Cayman Islands? The people.
Wendy, if anybody should be asking that question, it shouldn't be you, dear, but Health City is going to provide career opportunities. It's going to provide inbound investments. Well, let's start from the beginning. It's going to provide a large injection of capital to build a facility. It will provide, once operational, a large amount of inbound travelers. It's going to provide access, and this is one of the key things for Caymanians, people living here, to quaternary and tertiary care that's not currently available at a much lower rate than that's currently available, that we would have to pay if you went to the U.S., organ transplants and things of that nature. And obviously it will provide lots of jobs and career opportunities. Obviously, we plan to do an education program which will be successful and will allow Caymanians to train and become healthcare professionals as well. So I could go on for hours, but the opportunities for Caymanians and Cayman in healthcare are endless.
Can I just confirm where it is as well, where it's going to be?
Pardon me?
Can you confirm
we
where
have
it's going
not
to be?
made a decision. The final decision, we've actually stepped back. We will do that. We will make a decision early next year.
Can you comment on the speculation that it's in West Bay?
We haven't made a decision. We haven't made. We've looked at. We have 5 sites that we're looking at that we have looked at, and we've actually kind of put that on hold.
Okay. And also, just to the Premier and the Minister, seeing as I probably won't get another opportunity, this morning the Speaker was convicted and he was handed a 60-day suspended sentence, among other things. Do you have any plans in Parliament to to present a vote of no confidence in the Speaker, or are you content to let him sit in his position?
Well, this is news to me. I haven't been apprised of that. Obviously, the government will have to take time to consider the matter, but what I will say about that is that there may or may not be another meeting of the House before the House is dissolved in March. I am not sure that the country would be well served now by my taking action which precipitates the collapse of the government and the holding of early elections. So we have to bear that in mind.
Thank you.
Okay, we will now hear from Ms. Norma Conley from Compass.
Morning, all. Just a quick question. You said medical supplies and equipment will be duty-free for the new facility. Are those duty-free for local medical facilities on Cayman?
No, they're not.
Okay. So one of the criticisms that always faced Health City was from the local operators who said that they were being treated unfairly, or that unfair concessions were being given to Health City, and now it seems similar with the new facility. What would you say to the local medical community who say they should also be given the same consideration?
Well, no other entity in Cayman up until now has made the kind of investment in healthcare that Health City did. Now, I wasn't part of the government at that time, and Health City got an incredible amount of concessions, but arguably, without those concessions, it would never have happened. Astor has asked for very little in terms of concessions. In return, they're building a $350 million facility, which is going to have immense impact on Cayman's economy, opportunities for Caymanians, not just in the construction of the facility, but the operation of the facility, educational opportunities, access to some of the best health care in the world. What amazes me about this place often is that all around the region, governments would give just about anything to have this sort of investment made in their countries. But in Cayman, we tend to complain about concessions. There are no free lunches. You have to make concessions to get good investments. And this is part of not just this administration, but the previous administration and the one before that. The long-term vision of creating not just a regional center of excellence for healthcare, being the Cayman Islands, but a world-class center. We have to continue to find ways to broaden our economic base, to not just sit on those two pillars of financial services and tourism. We've seen over the course of the last year what can happen and what is still the case with respect to tourism. One of the things about healthcare facilities is, and I don't want to seem insensitive about this, is that people get sick in good times and in bad. So there is a high level of insulation. I would have said general insulation, but COVID has changed the whole face of travel. But generally, unless there is some kind of global pandemic, this is, as Jean said, this is the kind of industry which is pretty much recessionary proof. And those are the sort of considerations that we have made when we enter or are about to enter into this agreement with Astor. We want to build out this area. There were those who claimed that Health City was going to really cramp the style of local healthcare practice. I don't have the number in my head, so I won't guess. I think the minister does. But actually, since the creation of Health City, the number of lawyers, I got them on the brain. I bounced from one of these things to another. Of doctors in private practice has probably tripled. So there is no shortage of business. Actually, facilities like this increase demand and create more opportunities generally for those in the practice of medicine. So I'm hugely excited at the prospects for Cayman. Over the course of the next 10 or 15 years, I just think that we're going to look back and say, wow, really we've come this far. Because that's what's happened. Even with some of the issues that Health City has had, I don't think most of us here can contemplate a Cayman now without the kind of health services that Health City provides.
Just a quick question for you, Jean, also. With regard to Health City, obviously when it started out, it was specialising in certain areas. Anything similar with this, with the new hospital? Are you going to focus on one particular area and then expand from there? Or are you going to, from the get-go, be covering all sorts of specialties?
Yeah, Norma, I think, we're looking at what our offerings will be. We will be a multi-specialty hospital, but in quaternary care. So what we would plan to offer are the areas of care that are definitely underserved, not only for Cayman, but for the region. So we're going to look at broad specialties in a broad sense of the word.
So at this point, any ideas which
We're looking at that now. We're looking at, there will always be overlap, but the goal is to be, to provide, to fill those gaps. And there are very significant gaps in the market. That's why so many Caymanians and so many residents have to travel off island. And not only off island, but people in the region have to travel for the U.S. because those gaps are still are in the region, and those are the gaps that we plan to fill.
Okay. And on that subject, obviously it's a bit strange to be talking about it right now with the borders still partially closed, but looking down the line, if we are going to be focusing on more regional customers as well as with the U.S., would we be looking at creating other flight routes that might enable this to occur?
I'll say this is that just to go back, there are now, Health City is not the only medical tourism provider in the market. There are about 7 other providers in the market right now. And what we've actually noticed is that once Caribbean Aero Caribbean started their link through Jamaica, which was obviously ceased early this year due to COVID, that made a very substantial difference because it created access to Down Island. And we believe that as we grow, as Astra grows, as the medical tourism grows, or destination healthcare grows, those routes will grow as well. The access from the U.S. is phenomenal. Once things are normal, the access from Canada is very good. South America struggles, but we believe that those areas will all grow.
Yeah, the point that Jean touched on there, for a lot of people in the Caribbean and South and Central America, access to the U.S. is quite difficult because they don't have visas. So establishing a sort of regular route, air connection between Cayman and, say, St. Martin, which is a regional hub, are all possibilities. We've been exploring those for some time now for Cayman Airways, and indeed, we run charters we used to run charters to St. Martin to pick up people from the region to bring them to Health City, which was paid for by Health City. So these things have knock-on effects, which immediately you don't think of until you actually start to do the analysis and you see how important something like this can be to other aspects of Cayman's economy, not just sort of the direct impact that you would initially consider.
Okay, thank you.
Thank you. We now
think Ralph
turn to
wants it.
Mr. Ralph Lewis from Caymanian Times.
Good afternoon, gentlemen, other members of the panel. Thank you for inviting us and for sharing the exciting news on the future development. I have a few questions for Mr. Thompson, Premier and the Minister. Mr. Thompson, just about the project. Do you anticipate a start date, and do you have an idea of the number of jobs will be provided regarding construction during the project?
Ralph, as quickly as we can get going, I would suspect by mid next year we will break ground. Our goal would be to get started as quickly as possible. And then the first phase, I think, if I'm not mistaken, will provide about 700 or 800 jobs. And they will be primarily Caymanian construction companies, very similar to what we've done in the past.
How important is this to the economy, especially going through the COVID era?
Well, Ralph, I mean, I think my personal belief is some of the heat in our economy now is going to slow down. We're seeing a lot of construction going on, but that will eventually slow down. I think later next year, middle to later next year, you'll see that slow down, and this will help to take up some of that slack.
Okay, I'm going to switch to the Premier now. Premier McLaughlin, regarding the industry, how important do you see medical tourism as a developing industry in the Cayman Islands in the future development and for economy and so on?
I think it can be incredibly important, and this exciting news today is so welcome as part of the vision that we have for healthcare provision in these islands. As I said earlier, I do not believe that Cayman can continue without massive risk to rely principally on tourism and financial services as the sole pillars of our economy. And we have to do everything we can to broaden our economic base and make ourselves more resilient to economic shock. This is exactly the kind of area that I think we should focus on, because the cost of labor in Cayman is so high. I mean, this is not a country that can go into establishing factories and building widgets. You know, we are known as a service provider. The tourism business and financial services and healthcare is another massively important service which everyone in the world at some point requires. So it is a real good fit for us, I believe.
You sort of answered one of my other questions. So you were saying that you'll see as reduced reliance on the tourism product that we currently have here, or do you see that bouncing back within maybe 3 to 5 years?
No, I'm hopeful tourism bounces back, but leisure tourism is something people do when they have money and they have time to do it. But when you get sick, you want access to the best health care that you can find and you can afford. So it is not discretionary spending in that sense. So that makes it much more resilient as a industry or a industry sector than more broadly leisure tourism.
Yeah, one more question for you, Premier. As we know, Grand Cayman attracts the majority of the tourism business, but Cayman Brac has always been out there by itself. There had been mention of developing some facilities in Cayman Brac. Do you see Cayman Brac being developed more for medical tourism than it is right now?
Well, I think that is the purpose of this initial clinic, to attract some business over there. Obviously, it's a matter of scale, and the Brac is not anywhere near the size of Cayman in population or otherwise. So, but it is important, and we are very grateful to Astor for having agreed in the very early stages of their establishment here to establish a clinic in Cayman Brac, and we can take things from there. We have to always bear in mind the views and wishes of the people from Cayman Brac in terms of how much they want in terms of development. Because when you establish, if you establish a big facility there that increases the population of Cayman Brac by 300 or 400 people, that is a massive impact on the economy and the infrastructure and other things. And we have to make sure that we plan for that if that's where we're going, and that more importantly, that's something that Brackers want.
Thank you. Mr. Seymour, I asked this question in a previous press briefing, and as I mentioned, if I had to live my life over again, I'd probably be a doctor, because it's a very lucrative industry to be in. And we asked what programs were in place for Caymanians to go off in that field. And from the report earlier, there is an intent to have a medical university. And what's your comments and responses to those future developments?
Thank you for the question. First of all, I just want to say that when this project was presented to me as Minister of Health, I pondered a bit, and as you can see or heard the Premier say, it took some time for us to take this through caucus and cabinet, because it's we had something similar, but as always, when a project is presented to you, you have to look at the environment internationally and locally at the time. When Health City came, it was after 2008 downfall in international economy. This actually came at a time when we were doing relatively well as an economy, albeit COVID. But we've always been looking for over 12 years now for a third pillar of our economy, because we recognize that these things have swings. You see what's going on with blacklisting and everything else. So we recognize that we needed a third pillar of our economy. And medical tourism seems to be the way to go. It has proven that it can work through other entities that are here. I asked for the Astor team. It says, we're interested in this, but we want to ensure that it's not the same bit of business that Health City currently has. And Health City, as we all know, heart specialists, and we wanted to ensure that Cayman itself and the region could benefit from having a diverse amount of offerings, and including NICUs, which is young babies that we have about 5 or 6 of them a year. And as you know, to even get Baptist or one of those overseas facilities to accept one of them, it's $1 million just for that. And imagine if we could find a situation where this country can benefit from paying just a percentage of that itself. That benefits us and goes a long way in many other areas that they're going to offer. When you get back to the scholarship and education part of it, that was one of the areas that I asked that had to be included in the offering. Cayman BRAC also had to be included into it to show their that they were really committed to the Cayman Islands itself and not just Grand Cayman. And I wanted not only just a promise of a scholarship, but I wanted it embedded in the contract, routed through the education department, and with a dollar amount on it. And I know we've seen a lot of proposals in the past. Many people have came with many different proposals, and it's turned out some of them have not turned out so good. So we wanted to ensure that this was actually spelled out in there. So you can actually see the effort the government has gone to ensure that, yes, we have a medical facility that's on here now that is giving Caymanians good service that they don't have to go off the island for. But we just didn't want to approach it as it was the same thing that we were getting and the same institutional registration that we were offering on here, but we wanted to ensure that there were penalties for not living up to the offerings that you're committed to and the agreement that you sign. And we made some mistakes in the past, as every country does, and but all in all, Health City has served the Cayman Islands well. People look towards the Health City as the place to go. They even go there for things that they shouldn't really go for, but that's the place that they look towards. And we hope that with Astor coming here, there'll be very little amount of services that our citizens in the Cayman Islands, and as we're all going to get old, and you know, it would be a pleasure to know that you can actually get your care right here, right at home. If you know the amount of calls that I get from persons who are overseas, someone hasn't paid a hotel bill, or you know, Cynical hasn't done this or that, and it's just a confusion and inconvenience for Caymanian families having to go overseas. We respect what the overseas facilities have done for us over the years and saved many Caymanian lives, but I think the time has come when we need to bring it home.
Thank you very much. Do we have a guest online still? On Zoom, can I ask a question?
Yes.
Okay. It was mentioned that they visited Cayman in early year and were very impressed. Did they visit other locations in the region? And can you say why Cayman was selected over those locations?
Dr. Mopin, I believe you're still muted.
Not muted. Yeah, I have unmuted myself. Yeah.
Go ahead.
Are you able?
Yes, we
Yeah.
can hear you now.
So I was telling that we have actually done a lot of research before coming to Cayman, and it's not that we physically visited, but there are a lot of advantages for Cayman when compared to other Caribbean countries. And we looked at the statistics and found that this is the best place where we can get. See, the greatest opportunity is as we go forward from the mainland US, the number of cases that could come. People travel due to two reasons for medical value travel, mainly two. One is the availability of expertise, and second is the tariff differential. And third, which is coming in many places, is the proximity. If they have to travel 6 hours, 12 hours, it is very difficult. So we thought that with the closest proximity with the mainland US, this country is the best suited if we have to get patients from the US as well as Canada. So there was not much of competition in that area. And this being by way of the facilities there, it's a developed country, and unlike many other Caribbean islands, it is much more advanced by way of standard of living, the per capita income of the people, and it is being considered as a very developed destination by people who are in the mainland. So we thought that this will be the best destination to attract patients from the US as well as from other places.
Thank you very much. That's all the questions today.
All right, thank you, Mr. Lewis. We now turn to Radio Cayman's April Cummings with a few questions, a couple.
Just a few, just a few. You've touched on this quite a bit, Mr. Thompson, but I just want to make sure that I have my head wrapped around what will be different about this venture than Health City.
I mean, it's another facility. I mean, it's a quaternary care, offering a substantial amount of different specialties that aren't currently available. That's the simplest way to see it.
And of course, I Googled during the press conference quaternary care. Mm-hmm. Could you talk a little bit about what that is?
It's just a much higher level of care, or the highest possible level of care that's offered in healthcare, with multi-specialty disciplines.
So not one primary area of focus, but across.
Correct, and it's multi-specialty.
One of the challenges, as I recall, faced by Health City, for example, were things like getting insurance from their U.S. providers to cover them here. Will any of that sort of thing be a problem for this project, or has that proven to not have been an issue?
Yeah, I mean, April, I think those challenges have been figured out. In the United States right now, over 70 million people, 70 million citizens are now self-insured or insured by companies and not necessarily by insurance companies or Medicare. So once you find the access to those markets, you find the access to the patients. In the Caribbean, it's a mix. Some are self-paid, some are government. And again, governments have become more and more willing to support these kinds of this kind of care because they've learned the cost savings and the quality of outcomes.
And you mentioned holding off on location. I just wondered why the pause?
Well, I guess we've been there's a lot going on right now, and we've been trying to work through the size, scale, how much property we need, where's filled, where's not filled. So we have to look through and figure out, and obviously cost.
Thank you very much.
Thank you.
Are there any further questions? If there are no further questions, thank you for joining us for this presentation on a second significant medical tourism project for the Cayman Islands. Thank you to our Premier, Honorable Alden McLaughlin, Minister of Health, Honorable Dwayne Seymour, ASTR's Project Director, Mr. Gene Thompson, Chairman and Managing Director, Dr. Azad Mopin, and Deputy Managing Director, Ms. Alicia Mopin. Thank you very much. Today's press briefing will be available on demand for our YouTube and Facebook channels. Until next time, take care.